All right, so this is chapter 33, self-concept. And really what we want to look at is differentiating what self-concept is and what self-esteem is. When we really look at patient care and we look at progress in care, we have to look at the entire person, right? So we call that holistic care when we're looking at all the components that make a person, right? So self-concept, if we're defining it, that's an individual's view of their self, how one thinks about themselves, their overall self-perception, okay? Overall self-perception, how they think about themselves. Self-esteem is how one actually feels about themselves. So that's their perception of their self-worth. So you can kind of differentiate the two between self-concept being more of how they think and self-esteem being more how they feel, okay? You're going to hear those words kind of used interchangeably a lot in healthcare, but they're really very two different concepts that are very closely linked together. So I know that sounds confusing, but they have their own meanings, but they are in relation to each other and one affects the other, okay? When you think about patients and all the healthcare problems that they can actually face, those healthcare problems actually threaten their self-concept and their self-esteem. So think about the patient that maybe has loss of bodily function, right? Or they can no longer have the same activity that they used to, or they're having a hard time managing that chronic illness. So we have to aid our patients in adjusting to those alterations in self-concept and self-esteem. Basically, so we promote healthy coping skills and positive health outcomes. All right, so scientific knowledge base, we know that the process of self-concept is a very lifelong process, and it begins in the home, right? It's parental influence in the beginning. So if you think about the school-age child, their self-concept or sense of self-concept is very inflated, right? Because they have these hugely, extremely positive resources generally, right? Like parents, maybe even teachers. And then generally you'll see that decline because they figure out that they're and receive actually more realistic information about their self. So, right, you get kind of like that realization, like, sorry, you're not actually a real princess or Batman, right? So that kind of concept that, oh, reality sets in and that inflation of self-concept is then lowered as they age a little bit more, okay? But generally that school-age child is super positively high inflated on self-concept. When you looked at adolescents can adversely affect self-concept and self-esteem because you have to think about all of the changes that happens in adolescence, right? We go through a lot of different changes. So, and that can directly either negatively or positively affect our self-concept and self-esteem, depending upon what those experiences are. When you look at adulthood, when we think of self-concept in adulthood, and again, it just kind of varies on the age of the adult, and we'll look at some of those things. A person in adulthood might think of like job satisfaction and they think of that in relation to their performance as an adult, okay? And those are very also linked to self-concept and self-esteem. So think about how that would be affected if a person lost their job, okay? And normally their individuals' behaviors are actually really consistent with both self-concept and self-esteem. And then self-concept affects perception of health. It is actually directly related to how one perceives their health. So if you think about a person with low self-concept, right? They do not think highly of themselves. Remember, self-concept is what one thinks of themselves. If they have low self-concept, then they're probably more at greater risk for health problems, right? Because that's probably where they're going to rank how they feel or prioritize, I should say, their health. So what a person thinks and feels about themselves also is going to affect their approach of self-care, and not only their approach to self-care, but how they care for others. So even think about that as in the role of a nurse, right? So if you are the nurse and have maybe low self-concept and maybe also low self-esteem, it's going to affect the way that you care for other people. Same concept when we think of our patients. Nursing knowledge base. So we're looking at factors that influence the development of self-concept. So that is box 33.1 on page 726. So here we're looking at Erikson, right? Everyone remembers Erikson. So Erik Erikson's a developmental psychologist. He's a psychoanalyst. Basically, he talks about the premise of how each stage builds on maybe tasks from the previous stage, and that we all as individuals actually experience crisis, and that experience of crisis is going to contribute to our psychosocial development. And if we are unable to overcome that crisis or failure to overcome, that's going to impact our psychosocial development, okay? So successful mastery leads to a solid sense of self. Basically, we learn to recognize an individual's failure, maybe to achieve what is supposed to be an age-appropriate milestone or developmental stage, okay? We can also recognize possibly when one regresses. So what would be an example of regression? You know what, think about kids. If we thought about kids, so maybe you finally get your little guy or little girl potty trained, right? And they're doing really, really well with potty training. And now you have another child, right? And so maybe because of the addition of another child in the home, a new baby, you might see some regression in some of the milestones or stages of development that that other child had, right? So, and it could also be due to other factors. So not even just another child in the home. You know, maybe if there are, you know, concerns or red flags going on at home for very different reasons, that can also cause regression, right? In a lot of different developmental stages, you might see that. So we also think about how self-concept is really, it's constantly changing, and it's based on a lot of different things, okay? So on 725, there's a good little list of a few of them, and just understanding them is a good thing. So a sense of competency, right? If you feel competent, right, that's going to improve your self-concept. Perceived reactions of others to one's body, right? So we're gonna look at body image components as well. Ongoing perceptions and interpretations of the thoughts and feelings of others, so how others perceive us matter. Personal and professional relationships are huge factors in this, and then academic and employment related identity as well. And some of this too is also really related to the age of the patient, and we'll see that kind of grouped by age. Personality characteristics, that affect self-expectations, and then perceptions of events that have an impact on self. Socioeconomic status, that can have a really huge factor as well, right? Mastery of prior and new experiences. And then of course, we always have a cultural identity that's always going to be a factor as well. When we look at self-esteem, we see that self-esteem normally in our younger years, it kind of increases and fluctuates. And as we get a little bit older, it's a little more constant, a little more consistent. And then you'll see between the ages of 60 to 70-year-olds, that's where our sense of self-esteem is actually very peaked, okay, is between 60 and 70 years. You want to think about too, about the older adult as far as the changes that occur when one is aging. We go through a lot of different changes, right? So if you think about the physiological change, our body changes. So we might have a decline or a deterioration of our health. And so when you look at the older adult, it's really important that you're focusing on the older adult as well. Think of what experiences they have, such as role changes that actually occur. Normally, the older we get, all of a sudden we start losing the people we love around us, right? So you might experience more loss and more death as you're getting older. And then your physical issues that may occur, right? So those abilities, you don't have as much energy and maybe don't have as much strength. And so those physical abilities have changed. And that's not something that maybe you're accustomed to, that you're adapting to as you age, okay? So The older adult, you want to think about some of those changes and declines in health that actually occur. So we just want to focus on health behaviors to help promote self-care, and then also in turn help promote self-concept. All right, components and interrelated terms of self-concept. So identity, you want to think about being oneself, right? Living that authentic life is based on figuring out who you are, okay? So typically when we first identify ourselves, that actually starts again in the home with our parental figures, okay? And later we'll have other role models. Our other role models could be peers, teachers, maybe even relationships we develop later. And that's going to affect the way that we identify ourselves, okay, and how we view ourselves. So it's an internal sense of individuality, wholeness, consistency of a person over time. And remember, it begins at home as a child with those parental figures. When you look at body image is more or less how we view our actual physical appearance, structure, or function. So, and that can change as well. Things as change when we age, right? Because we have, as I was talking about before, that deterioration in health. But what if we had a medical procedure that caused a change in that body image, right? So maybe I'm a healthy 25-year-old adult, right? A young adult, and I have some type of complication with my bowels, and now I have to have a colostomy bag, possibly permanently, okay? So think about being 25 years old, young, right? Just starting to begin the prime of your youth years is the way you could look at that. And now you have a colostomy bag on your stomach. So think about how that might affect somebody's body image because their physical appearance and function has now changed. So think about intimacy with somebody else. That might be very difficult for someone with that type of change to their body, right? Again, we have to look at our patients holistically, and that even means the sexual component of that as well. It matters. So we have to be able to educate our patients and help promote mental health and improve self-concept so they prioritize their health and take better care of themselves. So we have role performance, and that's just basically a way in which someone perceives their ability to carry out certain roles, okay? We have societal views of what those roles should be sometimes, and even normal changes with maturing, right? As we grow older, we take on more responsibilities. So being able to achieve that is important, and fulfilling those expectations. And so when you can fulfill those expectations, you have a more better sense of self, okay? If you fail to meet those role expectations, that can lead to a lot of other deficits and decreased self-esteem. And then of course, because they're so closely related, we're going to have an altered self-concept, which is the way we think of ourselves. And then self-esteem. So again, already mentioned, that's basically how one actually feels about themselves, their overall feeling about themselves. And that has to do with how they view their own self-worth. So if one feels capable, then of course your self-esteem is going to be more positive, right? Oops, sorry, trying to advance and it's not doing it. There we go. All right, so some factors that influence that. So any time anything changes, right, in your little bubble, your world changes, your health changes, things, that's going to threaten your identity. It's going to maybe threaten that body image and your role performance, okay, which will in turn is going to affect self-concept. So any change in health, it's a stressor. Of course, it's a stressor, and potentially it's going to affect self-concept. Physical change in the body actually sometimes will lead to that altered body image. And so that's going to affect identity and self-esteem. So think about the patient with chronic illness. So the patient with chronic illness is also going to have issues with role performance, because that role performance is going to be altered due to that chronic illness. So that again, in turn, is going to change the way one identifies and feels about themselves. So when we look at crises even, right? So if we have stressors that arise in our life because of a crisis, that can also affect a person's health. So think about the physiological changes that can occur, and those can actually cause mental and emotional complications because of that. So it's really important that we're providing supportive education, resources, and helping a person learn how to cope in a healthy way and respond to whatever stressors that they're going through or event that they're going through in their life in order to enhance that self-concept. Because ultimately, the entire goal of all of this, if we improve self-concept and the way one thinks about themselves, that's more than likely how they're going to prioritize their health. And we're all about preventative care, health promotion, right? So that's basically the purpose and why we value or stress the importance of self-concept and self-esteem. So we have those mental and emotional components, and those are going to profoundly affect one's overall health status. Okay, so this is figure 33.3. These are common stressors that influence self-concept, and that is on page 728. And so we basically talked about what body image is, identity, role performance, and those are all factors that are going to alter or affect self-concept and self-esteem. But what's great about this upside down triangle, if you will, is it's giving you a bunch of examples. So if someone had a body image issue, these are some factors that are causative factors of that. So you think about the patient with or who may have had a stroke, right? So maybe they have weakness on one side of their body, right? So maybe they're not as mobile as they used to, not as strong as they used to be. Maybe they can't feed themselves the same, even toilet the same. Those are huge factors that would affect someone's mental and emotional health, right? I use the example of colostomy already. You have two extreme examples here of anorexia nervosa and then obesity, right? So you have someone who doesn't want to eat anything because they're so fixated on their weight and wanting to be skinny. So, and typically that's very unhealthy skinny, not just your typical, I want to be slim. And then the other spectrum of that is someone who really struggles to lose weight, which is someone with obesity. Multiple sclerosis, amputation. Could you imagine you losing a limb? And, that could possibly cause some body image issues as well. So identity, those things that would influence our identity. Losing a job, maybe change in marital status. So that would be going through divorce, maybe abuse or neglect in the home, societal attitudes towards you, and then conflict, obviously conflict with others. Role performance. So anytime you cannot balance things in your life, such as your career and your family, your physical and emotional states, that is going to cause and alter, I should say, affect and alter your self-concept and self-esteem. Empty nest syndrome. So even as you're older and the kids are leaving the home, that might be a huge change in that role performance, right? Because you're not having to take on the role of caregiver for children. So that, for some people that might be great. For some people initially, they're going to have that empty nest syndrome feeling, and it might negatively impact their self-concept and self-esteem, because what do they relate themselves to be, right? They associate themselves and give worth to themselves because they've been able to care for somebody, and now they are no longer in that role. So that can negatively impact them. All right, so stressors affecting self-concept. Identity stressors. So identity stressors, basically, this can happen in like any time during the lifespan, but typically you see this more so in adolescence, right? Because adolescents are in this weird stage. They get confused with what their identity is. Why? Because they're just an adolescent, yet parents, maybe even teachers, media, or maybe try and throw adulthood on them a little bit, maybe sooner than they should, but they don't necessarily have the capacity to really transition into the role of an adult, right? So it causes that role confusion, or I should say not more identity confusion, right? They don't really have this clear, consistent awareness of what their personal identity is. And typically too, they have more difficulty establishing healthy coping skills as well. So they might have issues transitioning in that stage of life. Role performance stressors. This can occur in relationships, any type of situational transition that occurs. You might see it with parents and children. I'll give some examples of that in a second. What if you had a close friend or family member, or even a parent or child, pass away, right? So that can cause some role performance stressors as well. And maybe even if you have changes in your health status. So maybe typically you're a very healthy person, and now you have a new illness, or have now transitioned into a chronic illness because you've had it for a while. So it becomes now chronic. So that's now a role performance stressor, because your ability to take on the things you did before might not be there. Okay. Or it's just a change in that. So this kind of breaks it down into different categories, or different subsections of role performance stressors. So role conflict, when someone has to take on more than one role, right? So typically we have a role in life. When we have to assume more than one role, so 2 or more roles, and they're not very consistent roles, they're very contradictory of each other, that can cause role conflict. So what would that be an example of, or what would be an example of that? So what if you're an adult, right? And your parent, who is obviously an older adult, has become ill. And so now you are taking on caregiver of your parent. And some of you might already have experienced this. That is a role conflict, right? You are the child, that is the parent, but the roles have kind of reversed now. So you might even be financially taking care of them, physically taking care of them, helping them get to doctor's appointments, helping shower, feed, medicate them at home, right? Depending on the situation. But that role conflict has occurred because that is a inconsistent role that has completely changed for you, okay? Role ambiguity, that is basically where you have an unclear role expectation. So you're not really sure what to do or how to fulfill this role. And so that can create a lot of stress and confusion. And so before, I was kind of talking about the adolescent who maybe peers, media, whatnot, they're putting pressure on the adolescent to basically assume more adult-like roles. But again, they don't really have the capacity or the resources to do it. So it causes a lot of confusion and frustration for them. And that would be role ambiguity. So that would be an unclear role expectation, is the best way probably to describe that. Role strain, that's a combination of the two. Role strain is just a combination of role conflict and role ambiguity. So that's those huge feelings of frustration due to basically feeling inadequate in that role transition. And then role overload is exactly what it sounds like. You're taking on way too many roles, more roles and responsibility that you cannot manage. They're unmanageable. And this can happen when someone becomes ill. Body image stressors, that's going to affect appearance, structure, function of a body part. We kind of talked about that already a little bit. So maybe function or structure has changed. And so maybe the response of society or people who look at you to that physical change is what kind of alters that, okay? What causes some of those body image stressors. So not only is it the way you perceive yourself, but the way you feel or think others perceive you because of this alteration in structure. And then self-esteem stressors, this is going to vary, of course, by a person's developmental stage. However, I mean, it's kind of common sense in the sense that if you have high self-esteem and high self-concept, typically you're going to be more resilient and able to cope with whatever the demands and stressors are that you're taking on, better than those with low self-esteem or low self-concept. All right, quick quiz. So you are assigned to care for a patient who has just undergone a mastectomy for a malignant tumor. You would most appropriately classify the self-concept component as A, identity stressor, B, sexuality stressor, C, body image stressor, or D, role performance stressor. All right, so we got to break this down, right? They just had a mastectomy. Well, first of all, I need to figure out what the heck is a mastectomy, right? So that is a removal of a breast because they have a tumor, a malignant tumor, meaning a cancerous tumor in that breast. So if that breast is removed surgically, more than likely they're going to have scars, right? Not only are they going to have scars, but they're actually going to have loss of mass that's normally there, right? And for a female, that's important. So thinking of that, which stressor do you think that might be? So if you answered C, that would be correct. So remember that mastectomy is a removal of a breast, and that's going to affect one's body image. Therefore, it's an actual body image stressor. All right, so family effect on self-concept development. So our family plays a huge key role in our developmental stages and in that development of our sense of self. Okay, we get that from our family. We get that from our caregivers. We also gain what we would consider accepted norms from family, right? Because that's what you grow up around. So that becomes what's normal to you. And so sometimes even the most, the parent who really means well, so to speak, can unintentionally maybe cultivate negative self-concepts in children. Okay. Literature tells us that our parents are really the most important and highly influential person on a child's development, right? So, however, we all have different parenting approaches, and it also depends on what culture we're brought up in. So, a child's positive self-esteem and maybe their achievements in school are going to be fostered by parents who actually respond in very firm, very consistent, but yet a warm manner, right? So consistency is really important. So if you're really harsh and you're not consistent at all, maybe you're even a parent with low self-concept or low self-esteem yourself, that's going to foster or harbor a negative sense of self-concept and self-esteem for the child. They're going to pick up on that. So it talks about how we have the support of parents and how basically if those parents have a greater self-esteem, then there's probably going to be lower risk behaviors, right, from those children. Because again, they kind of pick up on what mom and dad vibes are putting out there, right? So it's really important that we have that positive communication with children and we have good social support. So again, the idea is we're fostering self-esteem and hopefully we have better transition as that child moves into the adolescent stage, which is a very awkward stage, right? You experience a lot during that stage. Again, that's a whole identity issue, trying to figure out who you are in that stage. And it's going to make it more complicated or difficult for that role transition or that stage transition, I should say, if that child has already started at a young age with low self-concept. All right, so nurses' effect on patient self-concept. Just as it's important that we are, we talk about the patient and we talk about promoting self-concept and self-esteem, right? We have to be aware of ourselves though, as well, right? We have to know what our own feelings are, our own values, our own expectations, even judgments, okay? So when we are conversing with patients and we're educating them or we are implementing patient care, every interaction, it should be positive, but it should also be very matter of fact, okay? Positive and matter of fact approach, very super important. That's what's going to aid you in building that trusting relationship with your patient. So self-awareness of the nurse is very critical and it's critical in understanding and accepting others. Okay. So it mentions here being aware of facial and body expression. So I'm going to tell you now that your actions speak so much louder than any word that could ever fall out of your mouth. I promise you. And patients pick up on your body language like no other. Okay. They pick up on it really quick, and you are the one who sets the vibe and the pace in the room. So if your body language is that of very closed off, very, I don't have time, very rushed, your patient, I promise you, is going to feel that, and they're going to be closed off with you and very short with you. And they're not going to open up in a way that you would want to, or you would want them to, sorry. So you want to make sure that you're very aware of what your body is doing. Okay. So your face and your body, they all need to be speaking the same language. This is the time where you want to start developing that nursing poker face, so to speak, so that you just remain neutral, so that you don't have a judgmental vibe about you. So your patient's going to want to open up and talk to you and share more. Okay. So be very aware of your own nonverbal communication. As far as non-judgmental attitudes go towards the patient, it's not just the patient, it's also family as well. So you always want to think about the patient and the family together. And then preventative measures, again, we want to, a lot of what we do in nursing is preventative, right? We intervene now so the patient hopefully doesn't have problems later. So it's all about promoting health and preventative care, so we don't see complications. So it's important that we are identifying issues maybe with self-concept and self-esteem early, so we can integrate appropriate treatments to help minimize the complications that they basically could have later. All right, quick quiz. You are caring for an adolescent patient who underwent a gastric banding procedure 6 months previously. This adolescent tells you, there's still a fat person inside of me. This type of statement illustrates a flaw in the self-concept of, would this be A, identity, B, self-esteem, C, body image, or D, role performance? Okay, so they had surgery. They had a gastric banding. So it sounds like they had a surgery to help promote weight loss, right? And they're an adolescent. So we know how adolescents, and they're trying to figure out who they are, right? So there's already awkwardness and difficulty in transitioning through that stage in life. And they still feel like they are fat, right? There's a fat person inside of me. So what do we think this more closely relates to in regard to the choices that you have here? So if you answered C, that would be correct, right? So because the patient's statement basically reflects the way they look. So remember, look, how they see themselves. You would relate that to a body image issue, right? Because they still feel like a fat person is stuck inside them. They're fixated on their physical features. Okay, so that would be body image. That'd be a better way to explain that. All right, critical thinking. So basically, we synthesize information that we've obtained. And where did we obtain that information? In a lot of different places, right? You guys are learning information here in school. When you get out on the floor, you're going to learn and synthesize information from the nurses that you work alongside of, from your patients, from the experiences that you have. So it's being able to gather that information from all of those resources, including the patient's family, right? And making your own decisions. So being a critical thinker means being independent. Okay, so you don't just do something because somebody else told you to do it because this is the best way to do it, right? Critical thinkers like to take and gather all that information, analyze it, and hopefully come out to a decision. So in regard to patient care, that is better for the outcome of the patient, right? And that takes time and it takes experience to be able to do that. You don't just come out of the box critically thinking about everything and having the right answers, right? A critical thinker is fair. They're fair-minded. They have insight. They have what is called intellectual courage. right? So they're willing to go and investigate that crime scene and gather information to come to a conclusion themselves based upon what someone else is telling them it is, okay? Critical thinkers also have integrity. They have perseverance. So what does that mean to have perseverance? Right? To keep moving forward, to keep searching out or seeking out the solution. Critical thinkers also have confidence and they're curious. They're curious jurors. They want to know why, right? That is the analytical side of a critical thinker, okay? So some of those things I mentioned you would also consider those critical thinking attitudes. Those are that cluster of the different traits I just mentioned, okay? Intellectual and professional standards. So they follow critical thinking involves following intellectual and professional standards. So where do we get professional standards? Well, what about places like the American Nurses Association, right? Policies and procedures within your hospital. So you want to think of all of those different resources that you are synthesizing and can also with your experiences that lead you to come to decisions that are in best interest of the patient. So self-concept profoundly influences a person's response to illness. I think we've already heard that. I've already mentioned that a few times throughout this lecture, right? How you perceive yourself and what you think about yourself is going to be in direct relation to how you actually see your health and the way you respond to illness when it occurs. Do you prioritize it? Oh, man, I'm short of breath. I'm coughing up green stuff. I need to go to the doctor and get this checked out. Maybe I'm getting pneumonia or bronchitis and I need some antibiotics. Or is it not as important to you, right? So you're prioritizing other things ahead of that because maybe you don't even view health as that important. It's no big deal. It's going to go away. I'm fine, right? Just things to think about when you're caring for your patients. All right, so self-concept assessment. So this is a figure 33.4 from your textbook. It's on page 732. And this is basically a critical thinking model. When you get into med-surg, you have been hopefully, or you're going to be learning more about the nursing process here in Foundations. But as you also move to med-surg, you're going to be looking at the nursing process, and integrating the critical thinking model. And we've actually talked about that in lecture a little bit in Pharm, okay? So it's really analyzing information so you can come up with a plan of care that's individualized for that patient, okay? So when you're caring for that patient, it needs to be very patient-centered, very individualized. So in the realm of self-concept, you want to be looking for behaviors and things that basically suggest or could be an issue with that patient's self-concept or their self-esteem. So you need to ask direct questions. You're not going to get an answer if you're asking closed-in questions that are just yes or no, and you're not getting the right responses. So learn how to ask the right questions so you elicit a response you need to make good clinical decisions, right? You want to watch and observe their nonverbal behavior. Remember, I said even as a nurse, your nonverbal communication and your body language is going to speak much louder than any word that could fall out of your mouth, right? It's the same with your patient. You have to watch their body language as well. And then you also want to look at things through the patient's eye. How do they perceive or even understand their particular health condition? Okay. And again, that's going to be influenced on their self-concept. So making sure that you also assess what maybe their previous coping behaviors are. So when things get really super stressful in your life, how do you normally handle that? Right? What do you do to stay calm, make good decisions? How do you deal with that? Okay, so we all have our own internal and external resources, right? So you need to assess what your patient's internal and external resources are. And you know who you can also get some insight on is the patient's significant other. They know them better than anybody else. They're with them all the time, right? So even employing some information from the significant other, they may have some insight into how that person typically deals with stressors, right? And that's, again, it's going to be in relation to that person's self-concept. So, I would know, oh, my husband gets stressed out super easy over X, Y, and Z. So knowing that is good insight. So that is typically probably how the way he's going to cope with a lot of stressors in life. So good information can be found also from the significant other. So in looking at this, this is a self-concept assessment again. So when we look at this model here, you can see in the middle, this is how we make good clinical decision-making. We're recognizing cues, right? So what cued you to believe that this patient may have low self-concept, right? So we might see those behaviors like in the way that they say things to us, maybe direct things that they say, or it could actually be nonverbal indicators, right? So we want to assess their environment, any presence of stressors, especially when we're caring for the patient. It says risk for lack of privacy, unplanned interruptions, right? So we always want to look at the environment that we are giving the patient when we're caring for them, decreasing noise levels, those types of things, offering them, or making sure we are not offering, but making sure we are providing privacy, right? And then standards. So you see in that bottom left-hand corner, so when I talked about professional standards, these are places that you can find those professional standards. So I mentioned ANA, that's right there, top of the list. Again, your facility is going to have policies and procedures and guidelines. And there's other places that you can find those standards, ethical standards. You have the American Cancer Society about breast cancer. Remember, we just had the question about the female with a mastectomy. And then attitudes. So display curiosity in considering why a patient may have certain behaviors. That's those critical thinking attitudes that I was mentioning before. Use integrity. You want to take risks as necessary in developing a trusting nurse-patient relationship. That's very important, right? Developing that relationship with your patient so that they're willing to open up to you and discuss those things with you. It gives you a little insight into their world. So basically using those assessment techniques to pick up and recognize cues that you should be taking action on, basically, right? Making a plan, figuring out some solutions, and then implementing those solutions, and then evaluating the outcome, right? Did the patient meet maybe the goals or outcomes that you wanted them to? If not, then we got to basically start over with assessment again and recognize and analyze cues. And it's just one big continuous circle that keeps going until our patient meets the outcomes that we've established for them. All right, so this is the planning phase. I kind of coupled a lot of this all together in this last slide. I just kind of went over it all. But this is basically where we are taking the cues that we have recognized, right? And we are in this yellow box that says prioritize the hypotheses, right? So we are identifying, we are coming up with nurse identified problems with this patient, and then we're making a plan. Again, so it all comes down to establishing outcomes and goals for the patient and developing a plan to help that patient meet those outcomes and goals, right? So we need to generate some solutions for that particular patient. So you might see some issues that you might see or nurse problems that you could identify. Could be that disturbed body image, right? So if it's a structural problem and they're thinking about just the way they look, right? It could be a personal identity issue. It could be a role performance or low self-esteem issue. And so in planning, you're going to learn how to use a concept map. And there's actually a concept map in this chapter that you can take a look at, but you'll be doing concept maps with your care planning as well. That concept map is on page 737. So just have an idea of what that is. And then there's a lot of teamwork and collaboration that goes in this as well. So realize and understand what your resources are, any referrals that the patient could possibly need. And again, remember that care, that plan of care has to be super individualized for that particular patient. All right, so quick quiz. Sorry, evaluation first. So Self-concept evaluation. So again, this comes to evaluating the outcomes to making sure that patient achieve the goals you would like them to. We want the patient, hopefully, right, to develop a healthy lifestyle, because it's typically, if they have a healthy lifestyle, that's going to contribute to a better sense of self-concept. So some things that we could do for healthy lifestyle. What could we do for this patient? Well, maybe we could educate them on some nutrition, right? Eating healthy, exercise, right? At least releases endorphins. You get the feel good high when you're taking care of yourself. Sleep and rest is so important, something that you guys aren't getting. And I'm not either, quite frankly, but something that we need. It's important. We need to rank it high on that list of importance. Stress reducing practices is also a good one, because we talked about how crises can affect the self-concept of an individual, right? And typically it has to do with whatever their coping mechanism normally is, or lack thereof, I should say. And then we just want to maybe evaluate the patient's lifestyles, right? And provide referrals to them if they need them, right? Especially if it's maybe alcohol cessation or smoking cessation. In the acute care setting, patients have higher potential threats to their self-concept, and that just has to do with, think about treatment. We implement treatments all the time, or diagnostic procedures. And what do patients fear? They fear what they don't know. They fear what they don't understand. So we need to provide them and empower them with the information so they're not afraid. So we need to make sure that we are talking to them, educating them about whatever the plan is in the hospital, anticipate changes. In the home care environment, because you have different care environments in which you can care for the patient, right? Depending on where your choice is that you end up working. In home health care, typically the nurse in home health care has a little bit more time and opportunity to work with that patient to reach goals, because again, they have more time, they're there with them longer. And so they have the ability and more time to help them more positively reach a better sense of self-concept. And then in the evaluation process too, you always want to try and evaluate things through the patient's eyes, okay? What is the patient's perception of successfully meeting a goal, okay? Sometimes you have to bring the patient back down to earth, right? They may have unrealistic goals. At the same time, you as the nursing, to make sure you don't have unrealistic goals for your patient, right? You can't have a patient that maybe has low self-concept, low self-esteem issues, and they are, I don't know, 350 pounds, and they are there because they need bariatric treatment, right? So you can't have this goal, or the patient, I should say, shouldn't have this goal of, I'm going to be 150 pounds in 2 months. Okay, that's not really realistic. So you want to make sure that we're helping them develop realistic goals that can be achieved. Because if they are stuck on these goals that are not achievable, and then they do not achieve them, then that just puts them at more risk for low self-concept and low self-esteem, right? All right, quick quiz. You are assigned to care for a patient who retired 6 months ago. While providing care, you identify that this patient is struggling emotionally with change. This situation most likely is associated with the self-concept component of. All right, so you're assigned to care for a patient, they retired 6 months ago. So there's a change here, right? Something's going on. They're having some emotional issues, right? They're not really coping well with this change. So do we think this is A, an identity stressor, B, a sexuality stressor, C, a body image stressor, or D, a role performance stressor? All right, if you answered D, that is correct. So this is, the patient's going through retirement, right? So this is a role change. So they were once in the role that they were working, providing for themselves, right? They didn't have the stressors of what maybe retirement could lead to, although retirement can also lead to great things as well. But if you've always associated yourself with someone who works, then that role change and that role performance can cause stressors that may affect self-concept and also self-esteem, right? So it's related to that lifetime of only knowing work. And then now you have this sudden change of no longer being employed. So what's important to understand, especially for this particular chapter, is understanding the difference between self-concept and self-esteem, right? And thinking about the different age-related stages and what one values as maybe a child versus an adolescent versus an adult versus the older adult, okay? So listen to those things that maybe were stressed upon during the lecture. I know some of the information, it sounds like so similar, so it can be slightly confusing. So just review some of the tables and understanding the difference between the two concepts that were mentioned, self-esteem and self-concept. And then also knowing what the difference is between if it was a body image or identity issue or role performance issue, being able to differentiate those as well is going to be very important. If you have any questions, please reach out. Thank you.